Imagine taking a medication to treat a debilitating condition. You expect relief, a chance to reclaim your life. Instead, you're hit with a side effect so bizarre, so out of character, it feels like a cruel joke. This is the reality for some individuals prescribed dopamine agonists. These medications, commonly used for Parkinson's disease and restless leg syndrome, have a dark side. They can trigger uncontrollable urges, particularly related to gambling, shopping, eating, and disturbingly, sexual behavior. We're not talking about a slight uptick in desire here, folks. We're talking about a complete personality shift, often with devastating consequences. Think about it. You go from someone who enjoys a quiet evening at home to someone risking it all at the casino, maxing out credit cards, and engaging in risky sexual behaviors. It's a terrifying thought, and sadly, it's a reality for some. To understand how these medications can cause such drastic changes, we need to delve into the intricate world of brain chemistry. The brain is a complex organ, and its chemistry is even more intricate. Specifically, we need to talk about dopamine, a crucial neurotransmitter. This neurotransmitter is often dubbed the feel-good chemical, and for good reason. It plays a significant role in our emotional and physical well-being. It's involved in our brain's reward system, playing a key role in how we experience pleasure and motivation. Without dopamine, our ability to feel joy and satisfaction would be severely impaired. When we do something pleasurable, eat a delicious meal, achieve a goal, or spend time with loved ones, dopamine is released in certain parts of our brain. This release is what makes these activities feel rewarding. This creates a sense of satisfaction, reinforcing the behavior and making us want to repeat it. It's a cycle that promotes positive actions and experiences. It's a beautiful system that keeps us going, encouraging us to seek out experiences that enhance our survival and well-being. This system is essential for our overall happiness and health. But like most things in life, balance is key. Maintaining the right levels of dopamine is crucial. Too little dopamine and we might experience lack of motivation, low mood, or difficulty concentrating. These symptoms can significantly impact our daily lives. Too much and we risk developing addictive behaviors, constantly seeking that dopamine rush regardless of the consequences. This imbalance can lead to a cycle of dependency and negative outcomes affecting our mental and physical health. Here's where dopamine agonists enter the picture. These medications play a crucial role in managing certain neurological conditions. These medications are designed to mimic the effects of dopamine in the brain. They act as substitutes for the natural dopamine that the brain is lacking. They bind to dopamine receptors, essentially tricking the brain into thinking it's being flooded with the feel-good chemical. This can help restore some normalcy in brain function. For individuals with conditions like Parkinson's disease, where dopamine-producing cells are lost, this can be life-changing, improving motor control and quality of life. But there's a catch. The benefits come with potential risks. While these medications can be incredibly effective for their intended purpose, they can also have unintended consequences. It's important to be aware of these side effects. Remember, dopamine is a powerful chemical, deeply intertwined with our reward and pleasure pathways. It influences not just movement, but also mood and behavior. By artificially boosting dopamine signaling, these medications can throw the whole system out of whack. This imbalance can lead to unexpected outcomes. Imagine a car with a faulty accelerator. Instead of responding smoothly to your input, the car surges forward unexpectedly. Instead of responding smoothly to your input, the car surges forward unexpectedly. This can be dangerous and difficult to control. That's what can happen with dopamine agonists. The brain's reward system can become overstimulated. The brain's reward system goes into overdrive, leading to an insatiable craving for activities that trigger dopamine release, even if those activities are harmful or out of character. This can result in compulsive behaviors that are difficult to manage. The devastating impact of these side effects is best illustrated through real-life stories, which bring to light the human cost behind the statistics. Take the case of John, a Parkinson's patient whose life took a dark turn after he started taking a dopamine agonist. His journey is a stark reminder of the unforeseen consequences that can arise from these medications. Once a devoted husband and father, he developed a gambling addiction that cost him his savings, his family, and ultimately, his dignity. The man who once prided himself on his self-control found himself spiraling into a world of chaos. He described feeling possessed by an urge he couldn't control, a stark contrast to his previous measured personality. The transformation was both shocking and heartbreaking for those who knew him. Another heart-wrenching case is that of Sarah, a young woman prescribed a dopamine agonist for restless leg syndrome. Her story is equally tragic and serves as a cautionary tale. Prior to the medication, she was a talented artist, known for her vibrant paintings and infectious laughter. Her creativity and joy were evident in every brushstroke. After starting the medication, she experienced an uncontrollable urge for online shopping, amassing a mountain of debt and a collection of items she didn't need or even want. The financial strain added to her emotional burden. These are just two examples of the many lives that have been upended by the unexpected and often devastating side effects of dopamine agonists. Each story is a testament to the need for greater awareness and caution. What's even more concerning is that these cases may represent just the tip of the iceberg. The true extent of the problem might be far greater than we currently understand. Section 5. The tip of the iceberg: prevalence and statistics. It's difficult to pinpoint the exact number of individuals affected by these adverse effects. Many people may be suffering in silence, ashamed of their urges or unaware that their medication could be the culprit. Some studies suggest that the prevalence of impulse control disorders in Parkinson's patients taking dopamine agonists could be as high as 15%, but the true figure remains elusive. Adding to the complexity is the fact that these side effects can manifest in various ways. Some individuals might develop a gambling addiction, while others might experience hypersexuality or compulsive shopping. This variability makes it challenging to identify and diagnose these disorders, further obscuring the true extent of the problem. However, despite the lack of precise figures, the evidence is clear. Dopamine agonists can have serious, life-altering side effects. The stories of those affected, coupled with growing scientific literature, paint a disturbing picture that demands attention. Section 6. Legal battles and ethical dilemmas. The devastating impact of these side effects has not gone unnoticed. In recent years, there has been a surge in legal cases against pharmaceutical companies that manufacture dopamine agonists. Families torn apart, lives financially ruined, and individuals grappling with the emotional fallout of their uncontrollable urges are demanding accountability. These legal battles raise complex ethical questions about informed consent and the responsibility of drug companies to adequately warn patients about potential risks. While dopamine agonists undoubtedly provide significant benefits for many individuals, the potential for such severe side effects cannot be ignored or downplayed. The debate continues to rage on, with patients caught in the middle. On one hand, there's the desperate need for relief from debilitating conditions. On the other, there's the terrifying possibility of losing control, of becoming a stranger to yourself and your loved ones. Section 7. The response: health authorities and drug companies. In response to mounting pressure and growing awareness, health authorities and drug companies have taken steps to address the issue. The FDA now requires a warning label on dopamine agonists, highlighting the potential for impulse control disorders. However, some argue that these warnings are often buried in fine print and don't adequately convey the severity of the risks. Some pharmaceutical companies have also faced lawsuits and paid out settlements to individuals who claim their lives were irrevocably damaged by these drugs. While these settlements offer some financial compensation, they can't erase the pain, the loss, and the sense of betrayal experienced by those affected. The response, while a step in the right direction, still leaves much to be desired. More needs to be done to raise awareness among both healthcare professionals and patients about the potential risks associated with these medications. Section 8. The importance of awareness and open communication. This is where open and honest communication becomes paramount. Doctors need to have frank conversations with their patients, clearly explaining the potential benefits and risks of dopamine agonists. Patients, in turn, need to feel empowered to speak up about any unusual urges or behaviors they experience while taking these medications. Early detection is key. If side effects are caught early on, adjusting the dosage or switching to a different medication might be enough to prevent long-term damage. Ignoring the problem, on the other hand, can have devastating consequences. This isn't about instilling fear or discouraging the use of these medications. It's about promoting responsible use, ensuring that patients have all the information they need to make informed decisions about their health. Section 9. Balancing benefits and risks. A cautious approach. Dopamine agonists can be powerful tools in the treatment of various conditions. They offer hope and an improved quality of life for countless individuals. However, like all medications, they come with risks, and these risks need to be acknowledged and carefully considered. It's a delicate balancing act. The potential benefits of these medications cannot be ignored, but neither can the potential for serious side effects. A cautious approach, characterized by open communication, careful monitoring, and a willingness to adjust treatment plans as needed, is crucial for ensuring that patients receive the care they need while minimizing the risk of harm. Ultimately, it's about empowering patients and healthcare providers alike with the knowledge and tools to navigate the complex landscape of medication management. It's about striving for a balance that prioritizes both physical well-being and mental health, recognizing that true